Taylor, I'm sorry, but we've got your test results back, and they come back that you're HIV positive.
Oh my God, my life is ruined.
These drugs are used for HIV infections both early and advanced onset. They lower the transmission from mother to fetus, and they're a first-line antiretroviral medication. Drugs in this class include Zygen, Videx, Imtrivia, Epivir, Zerit, and Retrovir. These drugs block reverse transcriptase that is needed to convert RNA into DNA in HIV. Don't worry, there are medications to treat this. There are drugs called nucleoside reverse transcriptase inhibitors that will help you. They will slow the progression of HIV infection and decrease the occurrence of its sequelae in your body. It increases the CD4 cell count and it decreases the viral load. It's going to be okay. The pharmacodynamics is that it blocks the HIV enzyme reverse transcriptase, which prevents RNA replication and the conversion to DNA, and thus preventing the HIV infection. These drugs' absorption is not affected by food. The drugs must undergo phosphorylation by intracellular kinases to exert its activity. They are metabolized in the liver and not the CYP450. They are excreted renally in the urine, and their distribution is protein-bound and cerebral spinal fluid. These drugs are used in combination with other drugs to avoid development of resistance with the HIV virus. The name of this therapy is highly active antiretroviral therapy. The combination of drugs used will be the NRTIs and protease inhibitors.
So I have to take all these drugs?
Yes, you do. Precautions and contraindications include pregnancy, hypersensitivity, severe renal disease, hepatic disease, bone marrow depression, and avoiding breastfeeding due to the risk of postnatal transmission. Now, along with these drugs are going to come some adverse drug reactions. Granulocytopenia, leukopenia, anemia, neurotoxicity, a headache, insomnia, muscle pain, diarrhea, nausea, and vomiting, lactic acidosis, increased liver enzymes. And for an overdose of this medication, it would involve anemia, fatigue, severe nausea, thrombocytopenia, vomiting, and a seizure. There are drug interactions with these medications also. Methadone increases the methadone clearance. Using these drugs with alcohol can increase the blood level. It reacts with bone marrow depressants and antibiotics also, because it leads to further depression. Do you understand?
Yes, ma'am.
These drugs are used in combination to achieve maximal virological response and decrease resistance. They're normally given in combination with 2 NRTIs and NRTIs or a protease inhibitor. Multiple drugs are necessary to maximize potency, minimize side effects, and increase viral suppression. Now, we're going to have to monitor you on a regular basis with these medicines. We're going to have to evaluate your CBC. We're going to have to monitor your liver enzymes, your increased creatinine, phosphokinase, and for lymphopenia. We're going to have to assess you regularly for a sore throat, fever, and signs of anemia. We're going to have to monitor your CD4 count regularly. We're going to have to assess you for hypersensitivity, which involves a fever, rash, GI symptoms, malaise, fatigue, dyspnea, and a cough. I need you to report these to me if you get these. We're going to also have to monitor your neurological assessment and the treatment effectiveness. Do you understand?
All of this for some HIV.
There's some patient education that I need to teach you. Take your meds at the same time every day. Use a pill box if necessary. There is not a cure for HIV. Now remember this. Notify your healthcare provider of a sore throat, swollen lymph nodes, malaise, fever, and any other kinds of infections. Notify of yellowing of your eyes, dark urine, light-colored stools, and a loss of appetite for several days. Please keep all of your follow-up visits so we can monitor you for serious toxicity. Take no over-the-counter medications without a doctor's approval first. And also, you're going to have to come in for us to do a blood count on you every 2 weeks.
This is too much to remember.
Now, the main takeaway of all the information that I have just given you is that HIV can be managed. It's not the end of the world.